Hello, I'm Brenda Hayman and I am your unit coordinator for health promotion and the nurse this semester. I can be contacted via email and my contact details are in your learning guide, which you'll find on the Views site. And the best way to contact me is via email. I'm often not in my office, so I don't often get my phone messages. So by all means, contact me by email and I'll be happy to be answering any questions and helping you. I want to talk to you a little bit about the unit that you're going to be doing this semester, Health Promotion and the Nurse. It's really about looking at the different ways that we promote health as the healthcare industry, and also having an opportunity to compare what people might do in different countries. I'm aware that lots of you come from various parts of the world as international students, and I think it's going to be really interesting this semester to compare what happens in Australia and what happens in your part of the world in relation to promoting health. There's 13 modules in this unit. Module 1 is looking at social perspectives and socio-political perspectives of health, and focusing really on what are the social determinants of health for people. So I think as we work through the modules, it'll become apparent that the social determinants for health for people living in Australia, for example, might be quite different to people in other parts of the world. So when we talk about social determinants of health, we're talking about things like education, financial status, gender can be a determinant of health. So whether or not you're a female, we know that women suffer more significantly with health problems than men across the world. So we'll be looking at all of those sorts of things in Module 1. In Module 2, we're looking at public health policy. Module 3, power and politics in health promotion. So in that module, we'll really be looking at power and how that affects the way people access health and health care. Module 4 is local effects of the World Health Organization policy. So we'll be looking at various policies of the World Health Organization and how they work to promote health in different areas of the world, and specifically in Australia. In Module 5, we're looking at the national priorities for health promotion, so that's locally here. So the local Australian government have a number of national health priorities. We're going to spend actually 2 modules, Module 5 and Module 6, looking at those and exploring what those priorities are and how they're implemented and what the disadvantages or the benefits are for people. Module 7 is planning a health promotion program. So this is going to be a really important module for your one of your assessments. I'm going to talk about your assessments in a minute, but for the moment, planning a health promotion program. So what are the things that you need to do, the things that need to happen to plan a health promotion program that's relevant, that's needs-based in your local community? What are the things that what are the elements of that program that you're going to that are needed to make it work effectively? Module 8 is planning health promotion program, assessing the needs of community groups. So we're going to be looking at various local communities and what are their individual needs. So for example, we might talk about remote populations of Indigenous Australian people or Aboriginal people, and what are their needs, which of course are going to be significantly different to the needs of someone who's non-Indigenous, maybe living in an urban area. Module 9 is an intra-session break. So you're going to have to rest that week, which you'll be happy to know about. Module 10, assessing the needs of community groups, planning health promotion programs. So I should probably just explain, Module 9 does exist, but for onshore students such as yourselves, you'll be having a break. Students who enrolled offshore will be doing a session on healthy, a module on healthy environments. So Module 9 does exist, but you won't be required to do it. You'll be having a break. So you'll skip straight to Module 10, which is assessing the needs of community groups, planning health promotion programs. So again, that's going to be a module that's really going to be helping you with your assessment, which is going to be about planning a health promotion program. Module 12, evaluation of health promotion programs. So what are the tools that we use to evaluate whether or not a health promotion program has been successful? So for example, we might talk about the immunisation program. What tools could we use to evaluate whether or not the varicella or chickenpox immunisation program that just started several years ago in Australia. How effective has that been? And I guess one of the things we'd be looking at is the rates of varicella in children today, as opposed to prior to the immunisation program being implemented. Finally, we have Module 13, which is really a summary of the unit as a whole, and an opportunity, I guess, to just draw everything together, all of the main points, and we'll have an opportunity to also talk about what they are in a workshop that's going to happen in that week. While I'm talking about the workshops, we have 4 workshops that are going to be run this semester. The first workshop is on Monday of week 1, so the 17th of July. So it's the first day of this semester. I'm hoping that everyone will be able to attend the workshop. We'll be talking a lot about your assessments, what the requirements are, how best to engage with the unit and move through the unit, how to use views, and what sort of resources will be available to you to support you in your learning this semester. So the 4 workshops will be held throughout the semester. There's one, as I mentioned, in week 1, and there's one in the final week, and there's 2 in the middle. The workshops have been designed to help to support you to get your assessments done, and also working through the modules with those activities. You've got 2 assessments in this unit. One is a essay, and the second one is a health promotion proposal. So there's lots of information about those assessments in your learning guide, and we'll definitely be going through that information as part of workshop 1. And I'll be supporting you also with discussion boards and other resources that I'll be placing on Views to help you get that assignment done. There's a couple of other things that I'm planning also. I'd like to offer a one-on-one consultation with the students to discuss your draft assignments this year. So I won't talk too much more about that now. I'll give you lots of information about it in our first workshop, and there'll also be information on Views about that, how to access those extra resources to help you get your assignments done. While I'm talking about Views, it's really important that you do access Views. I'm going to be adding relevant contemporary resources there on a regular basis. The resources will be related specifically to the module that you're studying that week, and they will be resources that will help you with your assignments, so both the essay and the proposal. So it's really important that you access Views on a regular basis. We'll be doing that during the workshops, accessing Views and doing different activities. I've got quizzes planned and some creative use of different apps and things that we're going to use. We're even going to get onto Facebook. And so it's important that you continue to look at Views and see what's happening. The announcements, I'll be making announcements regularly. So look at the announcements, look at the new resources, and make sure you're keeping up to date with the unit and what's going on. I look forward to meeting with you all in Workshop 1 and to supporting you through your learning this semester. Remember, I can be contacted best by email, so it's b.hayman@westernsydney.edu.au, and I look forward to meeting you on week 1 and working with you and as you work through the unit this semester. Thank you.